is the postural effects of what we call FHP, forward head posture, which is epidemic. This position, this head position is epidemic. Anyone who works on a computer, anybody who sits at a desk, anybody who reads a book, and we see these kids today, and even adults, you know, when they're idle, what are they doing? They're looking at their phone or they're texting, right? We're calling it text neck. That forward head position is devastating on your nerve system. And most people don't know why, because they don't always have neck pain associated with the forward head position. But I'm going to read a few of the consequences of loss of cervical curve, which is that curve in your neck, and forward head position. Long-term forward head neck posture leads to long-term muscle strain, disc herniation, and pinched nerves. This is out of the Mayo Clinic, March 2000. Number 2, in regard to respiratory dysfunction in chronic neck pain patients, a recent study demonstrated a strong association between increased forward head posture and decreased respiratory muscle strain in neck patients. At the base of the neck, the cardiopulmonary nerve. So what happens when you put a lot of pressure on those nerves? What do you think happens to cardiopulmonary function? It decreases. So poor posture can decrease your pulmonary output by putting pressure not only on the lungs but the muscles supporting this area for proper breathing and respiration. The third one, for every inch that your forward head posture, in other words, the position of the head should be right over the shoulders. For every inch that it goes forward, you add 10 pounds to the weight of the head. And the weight of the head is about a bowling ball's weight, 12 to 15 pounds. So if you go 1 inch forward, which is a very common imbalance, not that far forward, now it's 22 pounds. 2 inches, 32 pounds. 3 inches, and some people have it, 42 pounds. Did you ever hold a bowling ball? The biggest one they have is 15 pounds. And if you hold it like this, it's really heavy, but if you take it like this, yeah, so really bad for having that issue. 90% of the stimulation and nutrition of the brain is generated by movement of the spine, says Dr. Roger Sperry, who's a Nobel Prize recipient in brain research. Roger Sperry is the one who identified right brain, left brain function. Like the right brain is the artistic and creative side. The left side of the brain is the logical, analytical side. And he said that 90% of the stimulation and nutrition of the brain is generated by movement of the spine, and 90% of the output is used for relating the physical body to gravity. Only 10% has to do with thinking, metabolizing, and healing. So when you have forward head posture, your brain will rob energy from your thinking, metabolism, immune function to deal with the abnormal gravity-posture relationship and processing. That's a biggie. And Dr. Rene Calais, who's a medical doctor, Director of Department of Physical Medicine and Rehabilitation out of the University of Southern California, basically in a nutshell, it's a long paragraph, but he said that forward head position and loss of cervical curve will shorten your life.